New York joins a number of other democratically led states dropping indoor mask mandates. President Biden is weighing in, saying the move is, quote, probably premature. While COVID infections are down after the recent wave of Omicron cases, the CDC is still endorsing universal indoor mask wearing in all situations.
For more on this, we want to bring in John Moore. He is a professor of microbiology and immunology at Weill Cornell Medical Center. Thanks for joining us. It's time to lift. The question is it time to lift mask mandates, or do you agree with the president that it's just too early to make a decision like this?
Well, let's review where we are. The national infection rate is around 200,000 cases a day, and of course, many more are not recorded in the official statistics. Now, that's down about fourfold from the peak of about 3 weeks ago, so we've seen a great drop in cases, but 200,000 cases is a lot. So Omicron has not gone away. And Omicron isn't some kind of pussycat virus. We're losing 2,500 Americans a day to Omicron-induced COVID-19 in the national hospitals. But it's patchy. In New York, for example, we've come way, way down, and infection rates are much lower here than other parts of the country. So there's some nuance, and it kind of depends on where you live. But a lot of this is down to common sense. I mean, by now, people should understand their personal risks. There's a great deal of difference between a vaccinated 25-year-old who is not at much risk of severe disease and death and an unvaccinated 70-year-old who really is at serious risk of disease and death. So how you behave doesn't really depend on the presence or absence of a mandate. It's what you judge is best for you when you go into an indoor situation. Just because there isn't a mandate doesn't mean you can't wear a mask, and many people should and will still choose to do that.
Yeah, personal responsibility. You know, in the beginning, we talked so much about this was about ICUs and hospitals being overrun, and now people are wondering, well, if that's not happening, when do we just get back to normal and start treating this? I hate using this phrase, but it's the way we all say it. When do we start treating this more like the flu or a common cold?
Well, when the data justify doing so. If the Omicron wave will essentially go sometime during March. I mean, we don't know exactly what the plateau rate at the bottom will be, what it will go down to. Hopefully we'll get down to less than 50,000 infections a day, which is what we saw at the end of last summer. Perhaps that would be an infection rate nationally that we can just live with. But there may be additional variants that come along. Predicting the future is really, really difficult. So we have to adjust our behavior to the circumstances we see around you. And we all want this to be the last wave. We all want, from perhaps mid-March onwards, a permanently low infection rate that is equivalent to perhaps endemic annual flu, which is mostly a winter infection. So let's hope that that happens, but there's certainly no guarantee that it will, and we just have to watch and wait.
It's been tricky to predict, but here we are. It is Super Bowl weekend. More than 70,000 fans are expected to pack into SoFi Stadium. The COVID rules for the game, for the fans, most have to show proof of vaccination or show a negative test, COVID test, I should say. Do you think that method for the Super Bowl and other big events and gatherings is good enough, or do you think masking still needs to be enforced?
Well, it's almost impossible to enforce masking in a crowd of 80,000 sports fans who are going to be up and down and cheering their team on. I mean, you can insist on masks, it's just not going to happen. In sporting venues in Europe, the fans do not generally wear masks, but some of them do, whether or not there's a mandate. It's difficult to, short of going around with a nail gun and permanently attaching them, people are going to just take them off. Having an entry requirement based on vaccination and testing does make sense. And again, that's done widely in outdoor sports venues in Europe, where there's been restrictions reduced or removed on major outdoor gatherings. So that makes sense. And that would be harder to evade, although I'm sure some people will try to do this. But wearing masks, Yeah, if I was there at the game, I'd be wearing a mask, but I bet that the guy in the next seat may well not be.
Yeah, well, a lot of folks say if I have proof of vaccination, I provide a test, maybe the mask, should be an option.
Right. It is also the personal responsibility.
Right.
Yeah.
And it is outside, too. John Moore, we thank you so much.